Bismillahirrahmanirrahim. Assalamu alaikum. I am Professor Dr. Mahamuda Begum, Professor and Head, Department of Anatomy at the Women's Medical College, Mokbajar, Dhaka. It is my wish in the core of my heart that Allah subhanahu wa ta'ala give us to enjoy and complete the holy Ramadan. Dear student, let's start our today's session. I would like to discuss the other structure those are present in the posterior thoracic wall. Before I start, I like to let you know one dialogue that anatomy knowledge is the basic stone of healing disease. It is my kind request, dear student, always remember this. Now, thoracic duct. Now, thoracic duct. Thoracic duct formation, course, and tributaries. This should be touched in description of thoracic duct. So, thoracic duct formation from cisterna chyli, and the cisterna chyli, which is formed by the union of intestinal lymph trunk and lumbar lymph trunk. They form the cisterna chyli, and from the upper end of the cisterna chyli, thoracic duct goes upwards. The thoracic region, the posterior mediastinum, then it enter and drain in the junction left internal jugular vein and left subclavian vein. So this is formation, and this extend, and there is a ending. So what is thoracic duct? Thoracic duct are largest lymphatic vessels or great channel which drain lymph in the venous blood, but that means blood stream. And the lymph, the fluid present in the thoracic duct, it milky white color. Why it is milky white color? Because it is produced from the digestion of fat known as the chyli from the intestine. And this thoracic duct appearance is beaded. Why? Because there is a numerous lumen in the numerous bulb present in the lumen of the thoracic duct. So it is largest lymph channel, arise from the upper end of the cisterna chyli and end in the junction left internal jugular vein, left subclavian vein. And it is beaded due to the more bulbs present in the lumen, and the lymph, which is milky white in color, because it's the production of fat digestion from the intestine. Beaded. It is the beaded due to the valve, and the cisterna chyli arise from the cisterna chyli, goes upwards, and then end in the venous blood junction between the left internal jugular and left subclavian. This also showing the formation of the thoracic duct. This is the thoracic duct, and this is cisterna chyli, the abdominal region, because it is below the diaphragm. And through the aortic duct, the aortic opening, the thoracic duct enter the thorax and goes upwards and in between in the junction left internal jugular vein, left subclavian vein, left internal jugular vein and left subclavian vein. Extend from the upper end of the cisterna chyli, that is the posterior abdominal wall, then goes upwards through the aortic opening, enter the posterior thoracic wall, posterior mediastinum, and the beginning level, bony level, is the 12th thoracic vertebra and end in the root of the neck. Measurement: length about 45 cm and diameter 5 mm. 45 cm, 5 mm. Area of drainage. Thoracic duct drain the lymph from all parts of the body except this is the right side of the head and neck, right side of the chest wall, right lung, right side of the heart, right surface of the liver, and this all right side area is drained by the right lymphatic duct. So the tributaries of thoracic duct in the abdomen, lower 6 intercostal lymph node of both sides, in the thorax, pair of the ascending lymph trunk drain the lymph from the upper lumbar lymph nodes, lymph vessels from the posterior mediastinal lymph node, and pair of the descending lymph trunk which drain lymph from the posterior intercostal lymph node of upper 6 space. In the neck region, left jugular lymph trunk drain the lymph from the neck, left subclavian lymph trunk drain lymph from the left upper limb, left bronchointestinal trunk. Clinical correlation. Injury of the thoracic duct. Thoracic duct wall is thin and it colorless, so it sometimes injured inadvertently during the surgical procedure in the posterior mediastinum, like the surgery of the lungs. There can laceration of the thoracic duct, but then chyli enter in the pleural cavity and produce a clinical condition of chylothorax. So chylothorax is the more important clinical correlation of the thoracic duct. Descending thoracic aorta. This is the heart. From the left chamber of the heart, ascending aorta is arise, then reach arch of aorta, then it descend, the descending thoracic aorta. This is the heart, ascending, arch of aorta, descending thoracic aorta. So it is a continuation of the aortic arch, and at the level of the 12th thoracic vertebra, it passes through the diaphragm. There is opening of the esophagus known as the esophageal opening, and then it continues as the abdominal. Now it passes through the aortic opening. It passes through the aortic opening through the diaphragm and continues at the abdominal aorta. So these are the ascending aorta, arch of aorta, descending aorta, and there is a branches. Descending thoracic branches can be divided into visceral branch and parietal branch. Visceral branch like bronchial artery, esophageal artery, mediastinal. Parietal branch, posterior intercostal 3 to 11. So it should remember, dear students, that 1 and 2 is not branch of the descending thoracic aorta. Subcostal and superior phrenic. So the figure. This is the descending thoracic aorta, and this is the opening, the aortic opening. Through the aortic opening, descending thoracic aorta enter the abdomen and known as the abdominal aorta. It is in front of the vertebral column and behind the heart. That is the relation of the base of the heart and behind the esophagus. Esophagus. Now, what is esophagus? Esophagus is a fibromuscular tube-like organ. It about 25 to 28 centimeter long and approximately 2 centimeter in diameter. And esophagus transport food from the oropharynx to the stomach. From the oropharynx, this is the pharynx, oropharynx to the stomach, and it travels behind the trachea, heart, and then pass through the diaphragm, enter the abdomen. So this is the trachea and heart, and this is diaphragm. Now, start and end points of the esophagus correspond to the 6th cervical vertebra, 6th cervical vertebra and 11th thoracic vertebra respectively. So, start at the in front the cricoid cartilage behind the 6 cervical vertebra, and it is end at the 11 thoracic vertebra respectively. And gastroesophageal junction is correspond to the xiphoid process of sternum. Some important anatomical relations of esophagus, and these regions where the foreign objects or food are most likely to become stuck, and they can be remembered using the acronym ABCD. A for arch of aorta, the one constriction, and B for left bronchus, then another constriction, and the C cricoid cartilage, and fourth is the diaphragmatic hiatus. And measurement of this constriction, beginning of the esophagus, pharyngoesophageal junction, it is about 6 inches from the incisor teeth. Second, arch of aorta, 9 inches from the incisor teeth. Third is the bronchus, about 11 inches, and fourth is the diaphragmatic hiatus, 15 inches from incisor teeth. The distance from incisor teeth should be taken into consideration when passing endoscope or Ryle's tube in unconscious patients. Anatomical structure. The esophagus share a similar structure with many of the organs in the alimentary system. So first, from out to inside, first is the adventitia, connective tissue layer. Second is the muscular layer, and third submucosa, and fourth is the mucosa layer. The muscular layer of the esophagus, there is outer longitudinal, inner circular. This outer longitudinal muscle is differed in the three different regions. In the cervical or upper third, the longitudinal muscle totally skeletal muscle, and lower part of the thorax there is a mixed smooth and skeletal muscle, and third is the abdominal part is a smooth muscle. The mucosa, the lining epithelium is up to diaphragm, non-keratinized stratified squamous epithelium, and the abdominal part simple columnar epithelium. Esophageal sphincter. There are two sphincters present in the esophagus, known as the upper sphincter. This is the upper sphincter. Another is the lower sphincter. This is the physiological sphincter. They act to prevent entry of air and the reflux of gastric content respectively. Some important information. The esophagus in the neck, its length about 5 cm, then it descends over the supremediastinum, and the posterior mediastinum, its length about 17 to 18 cm, and in the esophagus in the abdomen 2 to 3 cm. So length of the esophagus also variable according to sex, age, physical condition, and gender. Like a newborn's esophagus is 18 cm long, and it begins and ends 1 or 2 vertebrae higher than in the adult. So these are the measurement from incisor teeth. Different measurement is taken. Now the vasculature. In respect to the arterial venous supply, the esophagus can be divided into thoracic part and abdominal part. In the thoracic part artery supply, thoracic branch of the descending thoracic aorta and inferior thyroid artery. This is the branch of the thyrocervical trunk. Thyrocervical trunk also branch of the subclavian artery. And venous drainage in the systemic circulation. And it occurs by the branches of the azygous vein and the inferior thyroid vein. So totally it is the circulation, systemic circulation. Venous drainage, the systemic circulation. And vasculature in the abdominal part, Esophagus is supplied by the left gastric artery. It is the branch of the celiac trunk, and celiac trunk is the branch of the abdominal aorta, and left inferior phrenic artery. This part of the esophagus has the mixed venous drainage via two routes, one to the portal circulation via the left gastric vein, another to the systemic circulation via the azygos vein. So, abdominal esophagus drain into both systemic and portal circulation, forming an anastomosis between two known as the protosystemic anastomosis. Innervation, that is nerve supply. Esophagus is innervated by the esophageal plexus, which is formed by the combination of the parasympathetic via the vagal trunk, and the sympathetic fibers comes from the cervical and thoracic sympathetic trunk. Now the lymphatic drainage. Lymphatic drainage of esophagus is also divided into three: superior third, deep cervical lymph node; middle third, superior and posterior mediastinal lymph node; and lower third, left gastric and celiac node. Now the clinical correlations, that is disorder of the esophagus. First is the Barrett's esophagus. Barrett's esophagus refers to the metaplasia and the esophageal carcinoma and esophageal varices. Esophageal varices is varices. Okay. Now the development of the developmental source. Esophagus comes from the foregut, cephalic part of the foregut of primitive gut tube. This is the end of my class. Thank you all. Allah Hafiz.